Welcome back to the Community of Practice on Autism Spectrum Disorder and Developmental Disabilities. We're talking about early identification. We've heard about early identification, strategies for addressing social communication, and now the exciting world of care navigation with Erin Thomson. Erin, please feel free, share your screen and go ahead. Thank you so much for being here.
Well, thank you for having me. I cannot talk and share my screen at the same time, so I'm going to do that and then I will start talking for real.
No problem. I'll remind people that there are some good communications going back and forth in the chat. So please feel free to continue to interact in the chat as much as you would like. I am trying to keep an eye on that as well.
All right, thanks, Tim. Thank you for giving me a little space to get us situated here. So I am Erin Thompson. I am a clinical social worker in the Waisman Center Clinics. I am a family navigator in the Autism and Developmental Disabilities Clinic, as well as the coordinator for that clinic. So if you are upset about the wait time, I am the person to talk to. So I'm sorry. I'm just going to apologize in advance. You're on our waiting list. I am also the social worker for the autism treatment program. And then I do a few other things, but those are probably most relevant to our talk here today. So within our clinics, we really think about I am not an expert on your family. I'm not an expert on what your daily life is. I always think about our role is to provide you with what's on the menu. So when you are thinking through how we are working to support a young child, whether you are a family member or a staff member, I really want to think us to think about our role as a professional is to share with families what the options are in their community and what the options are for their family, and then trust their expertise in knowing what is the right choice for their family and their individual child, because I cannot make that decision for you. I I I can't possibly know what is the right choice for all of the different facets of your life and your family and your family's life, but I can tell you what your choices are, and then you choose what's right for you. So I think that's such an important thing for us to think about. I think we can sometimes think that we want to tell somebody what's best, but what's best is the right choice that is sustainable for them over time and for their family over time. So much like Kellie was talking about what we can do consistently and repeatedly over time in terms of language, that's also true when we're thinking about accessing services. The services that you can access and continue to access on a regular basis are the right choice for your family. Oh, um, for our little ones, we really think about early intervention services, and that might be a program like Birth to Three, where they are providing a parent coaching model, and really working one-on-one with the child in their home and their parents to provide services and really helping parents think through how do they integrate strategies in their everyday life. For some families, that might be in conjunction or instead of a program like a childcare or Head Start or Early Head Start. I think prior to coming to the Wiseman Center, I worked for the Head Start provider here in Dane County. And one of the things I love most about Head Start is that children with disabilities are prioritized for program slots. So, I think oftentimes families run into barriers in accessing childcare. And I think Head Start offers a really great opportunity for families to access services, access childcare, access early education opportunities for their child, especially their child with special needs. Um, all right. The other thing that we want to think about for children over the age of 3 are special education or school-based services. And I'm not going to read through all these slides. I tried to put a lot of information in the slides so that you have them to reference in the future, but I also want to make sure that we have time for questions. I think when we think about an IEP, we're thinking about a legal document. It is really specifying what the child's education goals are, services, accommodations, modifications, how that child is going to be included in the general education classroom and activities. I think where we often see confusion from families is a child may have be found educationally eligible for services under a category of autism, but that does not mean they have a medical diagnosis of autism. So we often see children who have been waiting on our wait list who the school is serving them under an autism category, and then they are coming to us for that medical diagnosis. On the flip side, we have children who come to us for a medical diagnosis of autism, but aren't necessarily needing an individual education plan at school, and so they're not educationally eligible. So knowing just and helping families sort out when they say that their child has autism or a diagnosis of autism, like what do they really mean by that? Because I think we sometimes have families who we call to schedule. They say they've gotten an autism diagnosis, and then a year later they're calling us back for an evaluation because what they actually had was that IEP, but not the medical diagnosis, which can be tricky. And I think people use the word diagnosis really interchangeably when they should be talking about educational eligibility versus medical diagnosis. For some children, an IEP isn't necessarily what they need, but they do need what's called a 504 plan. It does not have to be written, but I encourage you to ask for a written document. It makes your life easier. And it can include specific accommodations, supports, or services for the child. And I think that's what's particularly important about a 504 plan is it makes sure that any adult that's working with that child is providing the same supports and services. I think sometimes families have a really great teacher who is naturally building all of these things in, but everything falls apart when there's a sub, or everything falls apart when they go to the next grade. And so really thinking about how we access those supports and accommodations on an ongoing basis. All right. For some families, while they're waiting or after they've gotten a diagnosis, they really think about how we access outpatient therapies. And that might be occupational therapy, so working on kind of sensory regulation or participating in activities of daily living, speech therapy, so working on our communication strategies, much like Kellie and Haley were talking about, or physical therapy and working on kind of how you move your body. And for some families, they may do all of that. They may do some of that. They may do none of that. They may do that in conjunction with birth to three or school-based services. They may do some only during the summer. They may do everything all year round. There's no right or wrong answer. I think that's that. If I have no other messages, there is no right or wrong answer because it's so specific to the child and their family. But I think really helping families think about that even while they're waiting for a diagnosis, all of the things that we've talked about so far are available to them. It's not a you can only do this once you have been diagnosed with autism. You can be working on any of these skills and strategies and working with any of these community based resources prior to getting a diagnosis and after getting a diagnosis. All right. I want to talk a little bit about autism treatment in Wisconsin. As a general rule, autism treatment is generally refers to applied behavior analysis. I know there is a lot of feelings about ABA, and rightfully so. But I think it's important to know what is out there and what is available to you. In Wisconsin, there is an insurance mandate, and so most Wisconsin-based insurance companies are required to provide coverage for behavioral treatment for autism. Generally speaking, they provide what's called a comprehensive level of care for children under the age of 5, and a focused level of care for children who are school age and older. Um, Comprehensive meaning closer to 30 to 40 hours a week, focused meaning less than 20 hours a week. And so I think it's important to just really think through what does that look like, right? And so when we think about what is a good ABA program, we're really thinking about a program that's focused on building skills rather than getting rid of behaviors, that we're really thinking about how we focus on positive reinforcement, how we're teaching what we want. Thinking back to that slide that Haley shared about how we are telling children what to do, we want to see that in the interactions that an ABA provider is having with children. Are they focusing more on using gentle hands, or are they focusing more on not hitting? Um, and we also think it's important that they're not trying to change behaviors that are core to autism, that are not hurting anyone. They're not hurting the individual. They're not hurting other people, right? So things like hand flapping or spinning or rocking your body, having unique interests, making eye contact, all of those things, there is nothing inherently wrong with those, right? So we may see a provider who is going to work specifically on things like self-harm or such as hitting your head, right? Like that's a behavior that's harmful for that individual. Um, Having an intense interest in Pokemon does not hurt anyone. It may get a little boring after a while for your communication partner, but it doesn't actually hurt you. Um, my official answer to all things Pokemon is Squirtle. That is my favorite. My 5-year-old is very into it at the moment. So. What you want to be looking out for, oh, geez, in terms of, okay, sorry. Red flags for an autism treatment program. It's a program that's not been proven to be effective. You really want to make sure that they're using data collection to track behavior and success, and really using that data to determine the course of treatment. That if you have lots of young and inexperienced practitioners who are not receiving a whole lot of supervision, if everybody is on the same curriculum, it's not individualized to that specific child. There's not a lot of positive reinforcement. There's a lot of focus on behaviors that are problematic versus skill development. I think it's really important to think about um, how we're assessing that service. I think sometimes we think about people who are providing us with a service as not something that we can question, but I really encourage families to think about autism treatment as a service that you are buying. You're a consumer of that service. You are buying it with your insurance dollars. And so you should really think about how you have entered into a contract with that provider, right? And so I think rather than thinking of it as somebody who is helping us, and it's hard to question somebody who's helping you, we're really thinking about it as we are contracting with that individual. And you wouldn't just not ask questions if somebody comes to do a repair in your home and then there's a big hole in the wall and doesn't repair that, right? Like, you would question that. The same, your child is even more precious than that, right? And so you really want to think about asking how decisions are being made on behalf of your child, what strategies they're using, how they are really teaching that child the skills that we want them to learn in a way that is in line with your parenting as well. So, Tim, I'm sure you're going to chime in if there's anything in the chat that I need to be responding to.
You keep on going. You have a little bit of time left. I am responding to things in the chat, but so far there's stuff that I can answer.
Beautiful. Okay. So the next thing we're going to talk a little bit about is how to find resources in your community. And honestly, if you take nothing else away from this segment of our training, I want you to keep in mind Wisconsin Wayfinder. So Wisconsin Wayfinder is a free resource that will connect you with your children's resource center. This is, and Tim, you're going to jump in if I say this wrong. So Wisconsin Wayfinder is really meant to ensure that there is no wrong door, that every family that reaches out to Wisconsin Wayfinder or their Children's Resource Center gets connected to the correct resource center for their area. I know we've got some of our colleagues on here. I see some folks from the southern region. I see some folks from the northern region. Um, I cannot say enough good things about the Children's Resource Centers. They provide information and referral to parents, to physicians, to teachers, to anybody in your community that is thinking about how best to support this child. The folks in each resource center knows the services available in those communities. It is a free and confidential service, and there is no referral needed. I know I work very closely with the folks in the southern region. I know I saw Araceli on here. We really work hard to make sure that we are sharing resources with families in a way that best meets their needs. And then for those who come through our clinic, um, because we see folks from all over the state, we really work hard to connect them with the local Children's Resource Center. So if we're seeing a family from up in Door County, I'm going to make sure that they are well connected with the folks in the Northeast region, because they're going to know way better what is available to that family than I will. And so I really encourage you to be connected to Wisconsin Wayfinder and the Children's Resource Center for your county. There is not enough good things that can be said about those programs and their ability to support families and connect families to what is available to them. And I recognize here in the southern region, particularly in Dane County, we have access to lots of things, but they're going to know all of the things that are available in your county, and you should contact them. All right. The other thing that we talk with families a lot is how they're going to pay for services and supports. Two things I like to highlight are the children's long-term support waiver. or CLTS. So CLTS is a Medicaid waiver program. It provides case management and funding to eligible children and teens with disabilities. And it covers things that are not covered by health insurance. So things like respite care, child care for children who are over the age of 12, as well as supporting inclusion for younger children, social skills groups, camps, sensory items, safety materials. Um, CLTS, there is, as is with all things, there is variability in kind of what the wait time is to access that. Some counties, it is really as long the amount of time from eligibility to being assigned to a case manager is very quick. Other counties, it can be a pretty lengthy wait. But I think it's really important to know that this is available and that it's important service for families and helps them be connected with everything that they may need to access.
About 5 minutes,
Eh,
Erin.
Oh, I think I have like 2 slides left, so I'll be good. All right. And then some families are able to access things like Katie Beckett or Medicaid through the Children's Long-Term Support Waiver. And what those do is they provide Wisconsin Medicaid for eligible children is based on the child's needs. It's not based on income. And it can act as primary or secondary insurance. So for some families, Katie Beckett Medicaid, or for some children, Katie Beckett Medicaid becomes their primary health insurance, and for others, it acts as additional coverage in addition to their family's private employer-based insurance. What is helpful for families is there's not an HMO attached, which allows greater access to providers across healthcare systems. So depending on where you live, there may be a number of different healthcare providers in your community, and having that straight or Title 19 or non-HMO insurance really helps you to access the right providers for your child. Um, Medicaid will also pay for things like diapers and pull-ups for children over the age of 4 and mileage reimbursement to and from or rides to and from medical and therapy appointments. And that can be a real benefit for families because, especially if you're traveling long distance for specialty care or you have lots and lots of appointments, it can be really helpful to have ongoing non-emergency medical transportation available to you. All right. So those are my resources I wanted to share with everyone. And then I wanted to make sure we had time for questions. You are welcome to ask me specific resource questions or our group. But I know we've got just a couple of minutes.
You're doing great. Yep, couple minutes, and then we'll also open it up to the other presenters come back. But there is a question about, do you know of any resource out there for neurodiverse friendly dentist, barber, hairdresser, other challenging services for kids? We've had people recommend connecting with Children's Resource Center to find their local information that may be, or an Autism Society affiliate in their area as well. So those two suggestions are out there. Do you know of any other specific resources around those services?
So I think I am loath to recommend this, but I think this is sometimes where the social media can actually be helpful to you. If you are in, a Facebook group or have connections, that's a great place to ask, right? Like parents know best. So I think Children's Resource Center, your child's teacher or birth to 3 provider, and then other parents are probably my best answer. But if there's others, I know there's a number of you from the resource centers on here. If you've got better answers, please chime in. Mm, mm. Tim, you're muted.
They are putting some into the chat right now. Um,
Beautiful.
so I would like to, we're right around at 10:50. I'd like to bring back our Kellie and Haley, Lily, along with Erin and open it up for, we have some time for some other questions that you might have. You could put them
Mhm.
in the chat and I'm more than happy to read them to you, or feel free to raise your hand and that should pop you to the top
Mhm.
of my participant list and I can call on you. James, go ahead.